Mobile DI is the perfect solution for portable digital X-ray and fluoroscopy. Weighing only 35 pounds, Mobile DI is the most compact mini C-arm on the market today. Using the custom wheeled storage case, it can be easily transported between satellite locations. Mobile DI quickly unpacks and mounts onto an optional accessory cart. This cart allows you to effortlessly move the unit within your office and achieve versatile and dynamic views of anatomy. Simply press the power button on the front of the device to begin. Mobile DI is a one-of-a-kind mini C-arm designed specifically for the clinical setting. With the high-definition 24-inch touchscreen monitor, patients and physicians can view anatomy in real time, improving patient satisfaction and clinic workflow. Mobile DI's detector size and rotation allow for imaging of all extremities, including hands, feet, knees, and shoulders. With Mobile DI, fluoroscopy can be used in your office for additional diagnostic procedures, such as arthrography, needle-guided injections, stress views, and motion studies which are accepted by Medicare for reimbursement. After completing a patient exam, you can easily review, save, and transfer images to your PACS or EMR system via the intuitive OrthoTouch display. OrthoScan Mobile DI. Portable digital X-ray and fluoroscopy for all of your clinical extremity imaging needs.
So I decided to purchase the Mobile DI for a few reasons. One of them, probably the most important, was the cost savings. When you look at the cost of getting a typical X-ray machine, you have to have a separate room, you have to have lead-lined walls, and so we're looking at $100,000 plus. Versus the Mobile DI unit, which was cheaper than that. So right off the bat, I would save money. And then you have the component of I can wheel it around, it's mobile. I can bring it right into the exam room. So there's patients that it's a little difficult for them to get up and go get an exam, maybe older, walker, whatever, wheelchair. Bring it right to them. And then as I'm doing the X-ray examination, I can point out different pathology. It's more of an educational component. They spend time with the doctor. I'm building that patient-physician relationship. And then if they need additional testing, I can perform fluoroscopy, I can assess the joints for stability. And then if I have to give an injection, I can do a fluoroscopic guided injection, which helps ensure that I'm adequately doing the procedure correctly, that I'm injecting it directly into the joint, which I'm aiming. They see the procedure, it benefits them. And also from a reimbursement standpoint, your X-ray machine now is capable of performing other modalities which can help your clinic. And then if you look at the actual flow of being a mobile unit, you can bring it outside the facility, you can bring it to a satellite clinic, or if you're dealing with athletics, go to the sports training facility, go to athletic events. So that's a big help for the teams. You can go to them, quickly assess an issue, see if there's anything that needs additional treatment or evaluation. So I would say that choosing this unit, I couldn't imagine practicing without it. That I couldn't imagine going the old way where you have a standard X-ray room and etc. This has provided so much better quality patient care. Not only do they love the high technology component of it, but then also the mobility standpoint that I can bring it outside of the office extremely easily. So there's no question on my mind it's the right decision. It's probably the best X-ray equipment you'll get for if you're an extremity surgeon.